My most memorable birthday present? That's easy. A red, shiny toy doctor's bag I got for my 5th birthday. That summer, I spent my days bandaging knees, tending to scrapes, and grabbing anyone I could to listen to them with my toy plastic stethoscope. I absolutely loved it and felt like this was something I was meant to do. 14 years later, I went to medical school to become a real doctor. The kind of doctor who has all the answers, who can really help people. And for a while, I really felt that I could. I learned the pathways. I mastered the checklists and memorized the protocols. I learned how to fix bones. I learned how to treat infections and diagnose appendicitis. But medicine isn't just about things that are broken. Life is messy, and the human body is complex. And I started to recognize that there was something invisible, like a layer beneath the symptoms, the scans, the silence. But I'd not been taught how to treat people who on paper looked like they were totally fine, but their body and everything about them told a different story. These are the patients that behind the scenes we call heart sinks. Not because there is anything wrong with them or that they're difficult people, but because we don't really know what to do with them. Let me give you an example of one. Let's call them Nick. Nick came to see me initially with pain, but their symptoms were fluctuating, evolving, initially with stomach pains, pelvic pains, heart racing, total exhaustion. We ran tests, but they all came back normal. So to try and find out more what was going on and get some answers, I referred to specialists, gastroenterologist, cardiologist, gynecologist. And I remember after scans, scopes, even keyhole surgery, getting one particular letter back that said, "This patient has a pristine pelvis, discharged." The problem was that Nick wasn't getting any better. They were in fact getting worse and unraveling. Once working full-time, they now really struggled even working part-time. Relationships were strained, parenting was pretty much impossible, and social life non-existent. And that's when the doubt started to set in. Maybe I'm just overreacting. Maybe it's just in my head and I'm making it up. Maybe I'm just too much. And that doubt started then to turn into shame. And so they stopped talking about the pain, stopped showing up to appointments, to follow-ups, stopped trying to seek help, because really, what was the point? And that's when the next issue of loss of trust in the body, loss of trust in instincts, loss of trust in a healthcare system that we once believed in. Because when people don't feel believed and seen, they just don't seek help anymore. And Nick's story isn't rare, it's routine. And it's happening in every GP surgery, every hospital, every day, every city, every country around the world. It's not a fringe issue, it's clogging up our system. It's stretching our already overstretched healthcare system. And the impact that has is that this doesn't just affect patients, it affects clinicians too, because we went into medicine, we trained for years to help people, to fix, to care. And when we see suffering, we see people struggling, and we just don't know what's going on, we don't have the answers, and we don't have services to refer people onto, it really impacts us, and it starts to wear us down. It causes job dissatisfaction, moral injury, and burnout. I know how that helplessness feels, not just as a doctor, but as a patient. When I was 21, I started to get really extreme symptoms of fatigue, mood crashes, and debilitating periods. So I went to my doctor and I was put on a variety of medicines that I tried one after another. And none of them really worked. So I went back to my GP to try and get some more answers. She knew that I was a medical student, and she said, "You've tried all the medicines, you've got two options. Either have a baby or have a hysterectomy." Seriously. I declined both of those options. But I quietly started to lose trust in doctors, even though at the time I was actually training to become one. So on the side, I tried different things. I went to so many different therapists. I tried antidepressants many times. And I've tried every possible alternative therapy that I could find. But there was just a real haphazard approach because I was also trying to study, and I'd been told by people over and over again that there really wasn't anything wrong and I should kind of be just grateful with what I had. Until 9 years ago, I became really unwell. So unwell that I was unable to work for 6 months and couldn't function barely at all for a month and barely even left my bedroom. My GP was kind, but she didn't have any answers, and the system just didn't have a clue what to do with me. It was terrifying. Fortunately, I'd found a therapist who was different to the others, and she gave me a word that I just had never heard in relation to myself: trauma. My response when she said that, I laughed. "Do you know who I am?" I actually said to her. Because look, I'm a GP. Everything I do is around mental health, or at least half of what I see. And not only that, I've set up mental health services in this country, in Australia. This is what I do. And all through my training and all through my professional career, I've been taught that trauma is in relation to combat and war. It's totally not relevant to me. She gently reminded me about the sexual trauma that I disclosed to her only minutes before. This was something that I had spoken to countless therapists, doctors, even a psychiatrist for the previous 2 decades, and not one person had helped me to connect that between how I was feeling and what had happened to me. That was a pivotal turning point. In a desperate attempt to try and understand what was going on with my brain and body, I did as much research as I could, trying to read about trauma, post-traumatic stress disorder, complex post-traumatic stress disorder. And I found this wealth of research that not just talks about trauma as a real thing and how to recognize it, but also the links between physical symptoms, not just anxiety and depression, but chronic fatigue, pain, gut issues, autoimmune conditions. And I just couldn't believe that we didn't learn about these things at all. Once I could see what was going on with the links between trauma and physical health, once I'd read the research and really seen just how much evidence was out there, I couldn't unsee it. In fact, I started to see it in every area, every speciality, every demographic, every single corner of care. And it made me really reframe how I was with patients. Instead of always asking, "What's wrong with you?" I started to ask, "What happened to you?" And then the answer started coming. So, do you think that the abuse that I struggled with or experienced when I was little is to do with why I'm drinking so much? Or, so the toxic relationship that I'm struggling to leave? Is that maybe why I'm having panic attacks and feeling suicidal all the time? Or the bullying that I'm experiencing at work, is that why I'm constantly feeling my tummy in knots? These were pivotal moments for these people. Seeing how impactful this was, not only for me, but also in my patients, I decided to try an experiment, to try and blend everything that I had learned and everything that I knew to try and do something to help people. I took my decades of clinical experience with all the scientific knowledge that I had from doing a master's in psychological trauma, my lived experience, and then taking everything that had helped me heal, lifestyle medicine, body-based work, and psychoeducation, and blended it together to create a program called Connection Works. This was a 12-month program that we delivered in small groups. And the aim of our team was to help participants to reconnect to their bodies, to each other, and to the environment. Because ultimately, it's connection that heals. Over the year, we taught people what trauma is, how it shows up in the body, how it hijacks behaviors. And we then blended simple human tools like what to eat, when to eat, how to rest, thinking about how to improve sleep, how to move, what time of day to move, and thinking about how we can tap into joy, pleasure, creativity, and then blended that with body-based therapies such as trauma release exercise or TRE, and yoga, equine therapy, acupuncture, reflexology, nature walks, foraging, and a couple of check-ins. It seems really simple. And it kind of felt like surely somebody somewhere must have done this. But the problem is, when you're in a trauma spiral, it's just so hard to try to work out what to do, in what order, and to get to those appointments. And as one participant said, to have this so beautifully curated takes away the anxiety and loop in my brain and lets me explore these things with safety and curiosity. That feeling of being held, when people feel seen and understood, then they start to heal. So the results? In the 12 months after the program had finished, we have from NHS data a 30% reduction in outpatient appointments, an 80% drop in A&E attendance, and 10% of participants went on to work or study. And self-compassion scores increased across the group. And self-compassion isn't some kind of fluffy, light feeling thing. It's a scientific clinical marker that proves recovery and improvement in mental and physical well-being. These were small numbers, but something really powerful and proof that there is a different way of doing things. We can't change our past, but we can change how we view people now, whether we view them with curiosity, and we have a choice about how we treat the next generation of clinicians. When we start to recognize psychological trauma as a root cause of illness and treat it with the severity that we do infections and injuries, we don't just change individual lives, we start to restore trust. And we can start to stop the transmission of trauma that slowly and silently happens from generation to generation. We can start to shape systems. We can start to change how we view healthcare in every city, every country, all over the world. And this relieves pressure it relieves cost. And it also helps us to tackle something that is really hard, to keep the carers caring. Staff retention in healthcare is really tough, especially since COVID. But when we equip clinicians with a trauma-informed approach, it doesn't just help them look after patients, it helps them stay in their jobs. And when they do, the system strengthens. So let's stop asking what's wrong with you and start asking what happened to you. Because real medicine sees the whole person. It listens, it responds, and it breaks cycles. And when we do that, we stop seeing survival as recovery, and we start creating healthcare that truly heals. Thank you.